My name is Vicki Wardlaw. Today I'm going to be reviewing the Cork Medical Nissus negative pressure wound therapy system with you. I will go over the device itself as well as the kits and show you how to use both. This is what the device looks like in the carry case. It's small, portable. Outside the carry case, this is the device with a 500 milliliter canister attached. Canister is very easy to remove. Simple pivot hinge here. Snaps in place. Soft silicone tubing comes attached to the canister. You have a clamp on the canister side and a clamp on the port pad side. This is what our port pad design looks like. Nice low profile, soft silicone. Again, comfort for the patient, safer. What I like to do is show a brief PowerPoint presentation so that you can see the screen and see how to go in and use this device for your patients. So this negative pressure system was designed and developed between 2012 and 2016. What I love about this is it was designed and engineered by wound care clinicians, nurses, with the end user in mind, meaning the clinician, you and me, as well as the patient. We wanted something that would be universal, that could move across all care settings, anywhere from the inpatient hospital side, OR, all the way through to patients using this at home. So we needed something that would be intuitive and easy to use. And I believe that we achieved both of those goals with this device. We also knew that we needed a workhorse. We needed something that could manage large, heavily exudating wounds, multiple wounds, and in any care setting. So we needed a really strong, powerful, reliable pump. This device, this Nissus negative pressure, has a pump in it that can pull 8 to 10 liters per minute. Typically, what you're looking at using in a post-acute outside of the hospital setting would be about a 4 liter per minute pull. Where this comes into play is those large, heavily exudating wounds, obviously, but also with our Drape, this pump can manage minor leaks. If you have a wrinkle or a bubble, or when your patient moves, you're getting a little bit of air pulling underneath the dressing itself. The device can handle that and keep to set pressure or your prescribed pressure without alarming automatically. So your end users, your nurses, and your patients will have fewer leak alarms. Precise pressure, we know that it's important to know what's happening at the wound bed, and with advanced technology that we had available to us when we designed and engineered this at Cork Medical, we were able to put that in the software, in the device itself. So with that, we were able to reduce the bulk of the nylon tubing that's out there that you see, multiple lumens, really specialized port pads that are heavy, that does not allow for low profile dressings. And honestly, it's easier for patients with a soft silicone tubing, and there's less risk of pressure related injuries from a medical device. Compact and portable. So this device is under 2 pounds. It comes in right at 1.9 pounds. It is in a carry case. It's small, it's light. It goes with the patient to the wound clinic or their doctor's appointments or physical therapy. I also like to add that it's quiet. We know that patients do not like the sounds that negative pressure make when they're wearing this out in their community, either to their doctor's appointments or when they're with their family or loved ones. So The request to have a quiet wound vac was important to us too. So this one is very quiet. When it pulls to the prescribed pressure, it's essentially silent. You will feel it vibrate, hear it hum a little bit if it's managing a pressure or managing a leak, but outside of that, it is very, very quiet. So that was important to us. It's important to our patients. We know that if patients will wear this, and they're comfortable wearing it. And the end user clinicians, nurses like you and I are comfortable using it. From that alone, we will see better outcomes, and we have. So when the screen is turned on, what you see at the top is a battery indicator along with the percent of battery that is left. We have a date and time up there. In the center is your target pressure. That would be your prescribed pressure or your prescription from your provider. These devices come from the manufacturer, from us, set at negative 125 millimeters of mercury, because that's typically what is ordered by providers, but you do have a range in this device from negative 40 millimeters of mercury all the way to negative 200 millimeters of mercury. Total runtime sits underneath that target pressure. That's the hours and minutes that particular device has been on that patient. It will come with 0 hours, 0 minutes, and when you put it on your patient and turn it on for the first time, it will start tallying up the hours and minutes, which is really helpful if you're trying to determine if the device is being turned off, if you're missing hours on there in between dressing changes. This is where you would go to look and see if in fact that is happening. Underneath that in the blue, it says continuous. That is the mode. This device is currently set at negative 125 continuous, but there is a variable intermittent option available as well. Variable intermittent means that there's a high pressure and amount of time, a low pressure and amount of time, never dropping off to 0. We know that that really causes problems with the dressings, and you can lose your seal that way. We also know that an intermittent granulates tissue really well. We like to see it used, so ours is a variable intermittent. I'll show you a little bit about those settings here in a moment. At the bottom, you have the buttons that you use to navigate what you're reading on the screen above. You have a power button, so when you press that, the device will turn on and it will automatically pull to your prescribed pressure. So if you have a new dressing on there, and you have a good seal, you don't have to do anything else, just turn it on. When you use the power button to turn it off, it will count back 3, 2, 1 and turn off. When you turn it back on, it will go back on to the previous settings. In the center, you have a menu select button, and that's where you go to your menu and you select what you have highlighted. You use the directional arrows around that center button to highlight what you want. Again, you use the center button to select or activate that. And then the exit button takes you back to your previous screen. In the little inset picture in the top left, it shows what the device looks like. In the carry case, there is a door on the front that is held closed with a magnet, and you can really essentially do everything you need to do with this device while it's in the carry case. You can change settings, you can go in and look around, everything except change your canister. From your home screen, you also have the ability to lock your patients out of the device. So if you're concerned that somebody's going in there and making changes, if you press the up and down arrow simultaneously, that padlock will close. You can do the same to take it out of lock mode. We also have a sleep mode indicated in the picture on the right. A small S shows up in the bottom right corner, and that is to conserve a little bit of battery. So if your patient is away from their charging cord and they're getting a critical battery alarm, this will dim that LED light that sits behind that screen, and it will save some battery. To do this, you press the left and right arrows simultaneously. That S will show up indicating it's in sleep mode, and then the light will dim. If you get alarms while it is in lock or sleep mode, the alarms will bypass both of these modes. They will still show up and give you the troubleshooting to manage those particular alarms. From your home screen, if you press the menu select button to go to the first menu, this is what you'll see. Therapy mode is highlighted. That is what it looks like when an icon is highlighted. Therapy mode always comes up highlighted first because that is typically where a clinician will go if you go anywhere. You also have alarm, which is the red triangle. I'll show you what's there. We have troubleshooting, which is the wrench and the screwdriver. I'll tell you about that as well. But with this device, we wanted to make it so that you didn't have to go look for any troubleshooting information or go find a guide or any kind of reference material. So when the alarms show, the troubleshooting information comes right up. If you ever wanted to go and read what is the information, what are the instructions, that is where you would go to look at that. And then we have the settings with the black and white gear. From therapy mode, if we press the center button, to select that, what you would see is on that center picture, continuous is highlighted and it says target MMHG 125. This is where you would set your settings. So this device is currently set at 125 continuous. If I wanted to change that, the target MMHG is highlighted. There is a left and right arrow, gray arrows on either side of the 125. That is where I would use my arrow to either increase or decrease my setting in increments of 5 millimeters of mercury. So if your provider is ordering 130, for instance, you would use your right arrow, press that once, then that target millimeters of mercury would change to 130. You would accept those changes after you try to leave the screen. So if you press the center button to select, or you try to exit, you're going to get another screen. So anytime that you're in there looking around, if you think you've made some changes, you will always have to approve your changes. And that screen will come up with yes highlighted, and then you would select that with the center button again, and your new settings would then take place from your old settings. If you didn't want to save your changes, you would highlight no, and it would just divert back to the prior settings. If you wanted to go into an intermittent mode, you would change from the continuous to intermittent by using your right arrow. Now intermittent is highlighted, and those are the values you would need to have in your prescription in order to run a variable intermittent. So you would need an up amount of pressure, and you would need an amount of time that you would like the device to stay at that pressure. You would need a down pressure value and the amount of time there as well. And once you highlight, make your setting, highlight, make your setting, and then exit, you will have to accept those changes again by pressing the center button. And then the device will run that sequence for your patient until you change it. You have 4 alarms on this device. You have a leak alarm, a blockage alarm, canister full alarm, and battery alarm. For your battery, you have 2. You have one when it's at 20%, and then you have a critical battery at 11% that will tell the user that you need to get it plugged in very, very soon. For your alarms, you will have a high-pitched beeping noise, and the screen will change, and it will ask you if you would like to mute the sound. That's depicted in that first picture. So this is telling me I have a leak alarm and asking me if I would like to mute the sound while I work on the alarm. It's a pause. It's temporary. It will come back on if you get distracted and don't manage the alarm reason itself. So yes will be highlighted. You can use the center button to select that, and then that will go away, and your instructions for managing that particular alarm will come up next. In the center picture, you can see leak is highlighted, and then number 1 instructions, inspect drainage canister to ensure that it has no visible cracks in it. So that's an easy place to start if you have a leak. Notice there's a downward arrow at the end of that sentence telling you would use your down arrow to go to instructions number 2, number 3, number 4, and so forth. And so that is the same for the blockage alarm. Obviously, the instructions would be different, and it would be specific to a blockage. And then for your canister full alarm, the picture on the right is what will come up, and then also more detailed instructions on how to change the canister. But as I showed you, it's very simple. In the red triangle alarm, if I were to navigate to there and highlight, select it, what I would see is in the center. Just know that we do have the ability to turn off the leak and the blockage alarm and the troubleshooting instructions that come up. We do have requests from providers to have this feature. It is have had a decision to do otherwise. What I want you to notice in there, though, is that log display at the bottom. If you select that and highlight and select that, what you'll see is on the right. That's a full history of the alarms that have occurred with this device with this patient. So you'll have your date and your time and what particular alarm was sounding with the device itself. That, along with the runtime on the home screen, is a really good place to look and go if you're trying to figure out what's been going on with your patient. Troubleshooting, I told you a little bit about what that is. It's basically instructions that automatically come up. If you want to read it, you would go in there and they're all there. Settings, the black and white gear, that's where you can go in and change your language from English to Spanish. You can change your date and time. You can also zero out that runtime that's on the home screen, the hours and the minutes. If you want to zero that out with your dressing changes to make your math easier, you can do so there. Factory admin, that black gear, just keep in mind that we do have the ability to tailor this device to a particular situation with a patient. Typically, if we use this, it would be for a patient that maybe has, it's a delay from the positioning from a point A to point B, bed to chair, there's a Hoyer lift, they're lying on their port pad, blockage alarm sounds. If we need to give the device a little more time to, or make it, give it a little more information so it doesn't automatically think there's a blockage, we can change the thresholds in the device itself. It does not change the therapy that the patient is receiving. It just gives the device a little more time to recognize what is happening with that particular patient. And your clinical support team can help you with that. This is what the canister looks like on the device. Notice on the left, that little black square, that's where the charging cord goes in. On the carry case, there is a little flap, Velcro flap that you can open so you can charge it while it's in the carry case. I just closed the flap over the charging cord. In the center, what I want you to notice on the left is that there are no O-rings or gaskets or anything to get lost or dried out or cracked on the back of the device itself. The seal from the canister to the device is in the canister. So every time you get a new canister, you get a new seal to the device, which is pretty important. Your canister has the solidifying agent in it. It also has deodorizers. The tubing is attached. There's a clamp on your tubing. So it is all self-contained, is disposed of because of that in your typical disposal in your care setting. And then also we have put a maze design in the top of the canister that really makes it very, very difficult for any drainage to egress into the device itself. The device, the canister goes on with that pivot hinge and just a very light snap-on, comes off very easily for our more arthritic patients. And the frequency of canister change is not any different with this. It's when the canister full alarms or once a week. You have a nice long battery life with this device, 24 to 48 hours. The charging cord plugs into the side through the carry case, but I want you to notice that there is a little blue indicator light that comes on by the power button that shows it is in charging mode and it is plugged into a working outlet. There will also be a lightning bolt that comes on the battery that also indicates that it is charging. Your kits, for your kits, you have an option of a small, medium, and large kit, and everything that you need to do a basic dressing change is in the kit. So you have a port pad, you have your foam, you have a drape, and there is a disposable ruler in there that you can use to measure or photograph your wounds. In the medium and large kit, you will have 2 sheets of drape. Everything in the kit comes packaged separately, sterilely, inside the outer package. So if you only use 1 sheet of drape, you still have another sheet of drape that's packaged separately that you can stockpile or you can save if you need it later. In the large kit, your foam, your piece of foam is significantly larger. So if you have a very large wound and you're bridging and you need extra foam, then you would order the large kit. The outside packaging has instructions on how to do a negative pressure dressing change, including window framing, including the size of the hole that you need to have underneath the port pad, which is the size of a quarter, which is the size of the opening on the underside of the port pad. If you need something beyond your basic dressing kit, we have available the cleanse therapy. It's a manual cleanse or installation therapy. It is a separate port pad that has an extra pigtail on it, and it comes with a 60 milliliter syringe. So your order from your prescriber would include what solution they would like to instill, how long the dwell time would be at the wound bed, the quantity of the solution, and the frequency. So this is a way to interact with those cells in the wound bed, the bacteria especially, and to try and kill some of that off in between dressing changes. We have a bridge foam kit. It is a floating bridge, so the sticky part is underneath the part where you attach it to the actual wound itself, and then it's also sticky underneath the port pad landing pad. The rest is not, has no adhesive on it, so you can fold it if you need to make it shorter. It is a floating bridge with your patients. We have a Y connector. This allows you to take 2 port pads on 2 separate wounds and run it to one device. And we also have an extension tubing that adds 24 inches to your standard tubing, which is plenty long. But if you have a really tall patient and the wound is on their foot, I have seen requests for an extension tubing. Now I'm going to stop sharing my screen so I can show you a little bit about the drape and the port pad. So our drape is standard. I told you we took the a lot of the adhesives, the binding agent out of the drape. This makes for an easier experience for your patients, less peri-wound breakdown. It also makes the drape a little more flexible. It's easier to tuck it around your edges of your wound if you're window framing. It is 3 layers. It looks like this. It comes folded in its outer packaging. It has directional guides on here for cutting to make sure that you always have your white handle and your tabs on the bottom to release that bottom layer. It's 3 layers sandwiched. It's the center layer that stays behind with your patient. To access the bottom, you use the little tabs here. You spread those open. That's the sticky part. That's what goes down on your patient, and you remove that layer. For the top, you access the top layer from the handle, the white handle itself. You pull that away. That removes the cutting guides and your little scissor icons. So when you're done, all that's left is clear drape on your patient and your white handle. Your white handle tears off last. So try to resist pulling the white handle off prematurely, or you won't be able to separate your layers. The drape itself is labeled 1 and 2 on the bottom. So your order of removal, and then 3 on the top. Your foam looks like this. It is intentionally thinner than what you might be used to working with. As clinicians, we spend a lot of time filleting the thick foam in half before we can use it on a more superficial wound. So we took away that step. If you need it for depth, you can stack it. But with this, you can easily cut your corner, spiral cut it, cut your port pad, landing pad, attach it to your bridge, have one contiguous piece, which is nice with a wound back. So that is your foam. Your port pad has a clamp on the end here. You also have a clamp on your canister side. This is a simple lower lock connection. There are no special caps or anything needed for troubleshooting. It just is a twist. Your port pad looks like this. It's also 3 layers. but it is paper on the bottom and paper on the top. You access the bottom layer first. It says remove first on the bottom from the side. That is your sticky part here. That goes down on your patient. There, the paper on the bottom is removed. On the top, it is split in the middle. So you can remove the top layer of paper just from the center split here. And then all you have left is this clear silicone port pad and the drape skirt surrounding the port pad. You can see it's nice low profile. This is the size of the opening that's on the bottom. It is the size of a quarter, and that's the size of opening we need in the drape for this to go over to get a good suction. That is all I have today. If you have more questions, feel free to reach out to the clinical team, clinical@corkmedical.com, and we will be happy to help you. Enjoy your negative pressure.